Intelehealth improves women's health access through telemedicine. We connect frontline health workers, so community health workers or nurses, typically in rural areas, with doctors at hospitals in urban cities so that women don't have to travel for care. When a woman has a health issue, she'll typically go to a local community health worker or a nurse for that health issue. And if it's something simple, the local health worker can solve it. But when it's more complex, like uncontrolled diabetes or a suspicious breast lump, she needs to be referred to a higher level center. 6 out of 10 women will not make that journey. Why do they not travel? It's because they may not have permission. They may not have access to mobility or money, and all of that becomes such a high barrier that they will just delay and they will live with an entirely preventable or treatable health issue. And for us, that's a human rights problem. When you connect the local community health worker or nurse through a telemedicine connection with a remote doctor, something magical happens. All of a sudden, you've created this safe and accessible digital space through which a woman can get the healthcare services that she needs. We work with existing community health workers and nurses, so existing brick and mortar healthcare systems like the government or nonprofits. And we turn these brick and mortar healthcare systems into brick and click healthcare systems. We have a really incredible open source telemedicine software. It's powered by a digital assistant, and that digital assistant collects the right data and information, the way a doctor would collect a medical history, to make that video consult really efficient. What also sets us apart is that we don't just look at technology. Just putting in a software into a last mile clinic is not going to change the healthcare journey for women. We also work with that health organization to effectively implement the telemedicine software through a validated 6-step implementation model. Over the last 8 years, we've implemented over 30 telemedicine programs, and to date, we have enabled over 10 million teleconsults. Today, we connect 9,000 doctors with 17,000 frontline health nurses. And in India, we work in about 7% of all healthcare centers in the country. And we've been able to show that 80% of patients after a teleconsult leave with improved health outcomes. For every teleconsult, we save about $11 in costs for that patient, and about 21 kilometers of travel. That builds very climate resilient health systems too. Over the next 5 years, we have the vision to 100x our impact, reach 100 million people, and save over $1 billion in healthcare expenses. It's really important that communities have access to ethical, evidence-based, and dignified healthcare. And we're glad we're playing our part in the health ecosystem to make that happen.